Hello, my name is Whitney Maynard. I'm an RN with Mid-East Ohio Regional Council. I will be educating and preparing providers on nursing quality assessment reviews and what we look for as QA RNs. First, we'll talk about the process for tracking expiration dates to ensure medication administration certificates are current. And we always look to see if there is a process documented in your policy and procedure. The agency needs to utilize the online application called MEORC to identify if staff renewals have occurred. A process for keeping track of this must be in place. Skills for each route of med-admin and health-related activities the staff completes must be in the MEORC. Evidence examples that the QARN will look for is maybe like a record indicating tracking of the certification dates for staff using online application MEORC. A mistake that we find is that when RN trainers put skills into the MEORC for each staff member, sometimes we see that only general medication administration is being selected. And general medication administration is just used at the beginning for each medication administration skills checklist. So we need to make sure that skills are present in the MEORC and not just general medication administration. Skills for each route of medication administration and health-related activities the staff completes must be in the MEORC. So for example, if a client is ordered oral medications, eye and nose medications, CPAP machine and oral suctioning, then the RN should put in the MEORC system general medication administration, oral medication, eye and ear medications, CPAP BiPAP, and oral suctioning. Another thing to remember is if the client, all the skills are in MEORC, but 3 months later, the client is placed on oxygen. And I am the QA nurse, I'm checking the skills in the MEORC system, and I do not see a skills check for oxygen. So what you'll need to do is provide a paper skills checklist of each staff performing this oxygen and provide that to the QARN. Next, what does the provider need to know about this certificate? It is good for 1 year only and must be renewed each year on or before your anniversary date. DODD recommends that your renewal and return demonstration be completed no earlier than 6 months after certification and no later than your actual anniversary date. For staff to renew their certificate, they must have 2 hours of approved continuing education on or before their renewal date. Staff must demonstrate relevant medication administration skills and relevant health-related activity skills. If you are in a site with nursing delegation, a nurse will observe your demonstration of skills. If you are in a site without nursing delegation, return demonstrations are performed and monitored per agency policy and procedure. What happens if staff fail to renew their certificate? Should staff not maintain certification due to lack of obtaining continuing education training, their certificate will be put on hold for up to 60 days. During this time, they must complete at least 2 hours of continuing education. They may not administer medications or perform health-related activities during this time period. Should staff allow their certificate to be in suspension for more than 60 days, their certification is considered lapsed, and they will be required to re-enroll in the 14-hour certification course to regain their certification to administer medications and perform health-related activities.